Hey everyone, Stafford here. This past week, our government gave us new health orders that impact us as a church. And so on Tuesday, the elders board and the pastoral staff all got together to examine those orders and to see how it affects us as a church and how we were going to move forward. It took us a little bit of dialogue and back and forth and being able to discuss this, but ultimately we came to a unanimous decision that we're going to move forward with two services, a 9:30 and 11 o'clock service. The 9:30 service will continue to be exactly what we have been doing this whole time. It will be nothing out of the ordinary if you've been back in person. We're still going to be operating under the capacity limits of 33%. In our case, that's about 115 people roughly in the service. We're asking everyone to mask up. Masks are mandatory. Socially distanced seating will continue. We're asking everyone to continue to pre-register. Nursery and toddlers will be open. And it'll be just like you've experienced. The second service at 11 o'clock is that we have chosen to make the second service a vaccine required service. So that everyone who comes, we're asking to be able to show proof of vaccination for the second service. So what that means is that everyone who comes to the 11 a.m. service will continue to have to mask up the entire time. Masks continue to be mandatory. There won't be socially distanced seating requirement. We're still asking everyone to register in advance so we know who's coming. And kids ministry will happen from preschool all the way up to grade 6. Now, this was a decision that took us a bit of time to get to. And ultimately what it came down to is we really want MAC to continue to be a very inclusive church where everyone feels safe to be able to come and worship together. From the very beginning of this pandemic, we have taken steps to not just meet, but to exceed the public health orders, to set a good example in our community, to show that we're taking these health orders seriously, to show that we love others, and especially protect the most vulnerable. We've done masking, socially distanced stuff. We've even shut the whole thing down and gone just online, really to help out our healthcare system and our community and show love to our community. And as we're in this next stage, we realize that there are people who have come back and have been a part of our in-person services, and we love that. But we also understand that there is a group of our congregation and our community that have not been back to in-person services, who have been waiting for a time where they feel safe to come back for whatever reason it might be. And a large group, attending a large group gathering where not everyone is vaccinated can be quite unnerving for them. And we really want to provide them an opportunity to come and to worship together, understanding that there are people who really need community but don't feel safe coming back to such large crowds. So we want to provide an additional service to the things that we are already doing. That additional service will be vaccine required. So what does that mean for the 11 a.m. service? Well, when you are coming, we do ask that you show your vaccine card when you come to church. And I know that feels weird. I know it can kind of make you go like, this doesn't feel natural. And you know what? It isn't. But the reason why we're asking you to do that is if we're going to be telling everyone that this is a vaccine required service, we have to follow those rules and the health orders. And those rules state you need to be able to prove that you have your vaccine requirement. Also, it shows and demonstrates to everyone else who's there that we're taking this seriously. If we're inviting people to come and saying you have to have your vaccine to come to this particular service, we want to enforce that, yeah, everyone here can be trusted that they have been vaccinated. Now, these are temporary measures, and we did not come to these conclusions quickly and easily. These are very difficult times that require difficult decisions. And so we are going to be moving forward with this as a plan on a temporary basis and evaluating it all the time in light of whatever the newest health orders are and in consultation with local medical experts. Now, if you have any questions about how we got to this decision, would like to talk to anyone, would like to feel heard out or ask questions, or even maybe just get something off your chest, I invite you to reach out to myself, any of the pastoral staff, or any of the elders. All of us would love to be able to make time to hear you and to hear from you and to hear what your concerns might be. And I just want to invite you to do that and understand that this decision that we made really was one that we believe helps unify the church and not divide it. The unity being is that we want to provide opportunity for everyone to be able to feel safe, to come together, and to worship in person. Now, we might not all agree on exactly what the decision was, and I totally get that. But even if we don't agree, I want to urge you to not let this become a divisive issue in our congregation. In fact, it is working through our disagreements that as a community, we grow together. So again, if you have any questions whatsoever, please email any of the staff or any of the elders, give us a call. We'd love to chat and to talk further with that. Grace and peace, everyone, and we'll see you on Sunday.